All right, continuing on with defining the birth terms. This is part 2. We're going to get right into it with something called Cytotec. This is an incredibly strong, controversial medication. It comes in pill form, used to induce labor. But the issue here is that it can cause hyperstimulation of the uterus and other potential complications, according to a study published in the Journal of Perinatal Education. It's also called misoprostol. And yeah, it's something that some care providers prefer. I think, don't quote me on this, it is a lot more affordable than Pitocin. I would talk to your care provider about it. And my personal opinion is not to use it. If you really need to be induced, I would recommend, using Pitocin instead. But I am not a doctor, or a midwife, so talk to your care provider about that extensively and do your own research before saying yes to Cytotec. All right, delayed cord clamping. All right, so this is the practice of allowing the umbilical cord to stop pulsating before it is clamped and cut. This allows the blood from the placenta to be transported into baby, sometimes increasing the baby's blood volume by up to 1/3, which is amazing. It helps to minimize iron deficiencies and it supports brain development. So this used to not be done because some believed that allowing the cord to stop pulsating increased the risk of the mom hemorrhaging or bleeding out. But it's since been found that clamping and cutting after the cord has stopped pulsating doesn't impact hemorrhaging one way or another. But it does have incredible benefits for the baby. So unless there's an emergency situation where baby needs to get with the NICU team right away, I really recommend having delayed cord clamping in your birth preferences and reminding the care provider right after baby comes out that you want to do delayed cord clamping. All right, dilation. So this refers to how open your cervix is, and when it is at 10 centimeters, about the same diameter as a softball, you're fully dilated and you can begin breathing the baby down or pushing the baby down. Early labor. So this is the time from the onset of labor up until the cervix is 3 centimeters dilated. That's considered early labor. Some women barely feel early labor at all. I did not. The only thing my early labor consisted of was diarrhea, yay! But that was it. I didn't have any contractions or anything like that. But some women do feel early labor and they need to start utilizing their techniques like breathing and other pain relieving techniques you learn in childbirth preparation classes or in a book like mine, Feng Shui Mommy. Effacement. So this is the thinning of the cervix. It starts out being about 3 to 4 centimeters long, and as labor progresses, it gets shorter and thinner and wider. So the widening is the dilation, and the thinning is effacement, the thinning and shortening. Okay, engaged head. So baby's head being engaged means that it has settled into the pelvis. This generally happens during the end of the 3rd trimester when you're nearing labor. When this happens, you will typically be able to breathe easier as there's less pressure on your diaphragm. You might also feel increased pressure in your uterus. So I've also had some moms that say when they felt baby's head engaged, they also had less heartburn as well. And I remember, oh my God, the difference in the walks that I would do every day once his head was engaged was really interesting because while I could breathe easier, I now had to start waddling because I felt like there was a watermelon in between my legs. It was so cute. All right, engorgement. When your milk comes in and you get these like giant rock hard boobies. It's so great. Oh wait, it's not. It's really uncomfortable. They can occasionally what am I saying? rewind. Okay, so engorgement. It hurts really bad. It happens when your milk first comes in, and to minimize the engorgement, obviously breastfeeding, it helps to drain the breast, but sometimes it's hard for baby to latch on because the breasts are so engorged, the nipple seems like tiny. So to soften it, you can put warm compresses, you can self-express some milk by just simply pressing on either side of the breast. All right, epidural. So this is the most common type of pain relief during birth, and it is a local anesthetic that blocks nerve impulses from the lower spinal segments, and it creates numbness from the waist down. After you're given 1 to 2 liters of fluid via an IV, an anesthesiologist numbs the injection site and the lower portion of the spinal cord, and then they administer a small catheter that's attached to a needle. So after that's applied, the needle is removed, the catheter remains, and that's how the medications are administered. They're administered by pump or occasional injection. And these medications are usually a combination of numbing agents and opioids. So after the epidural is placed, you'll typically only feel pressure during contractions. And while most women don't get that like loopy, let me tell you all my secrets, feeling, some might feel a little drowsy or woozy after the epidural is placed, but a lot of women don't feel that. Okay, episiotomy. So this is a surgical cut made in the perineum, which is the tissue between the vaginal opening and the anus, and it makes it easier for baby to emerge. While episiotomies used to be commonplace, they're now only typically performed in emergency situations because it's believed that, if excess room needs to be made, the vagina will naturally tear, and that it's better to allow it to just naturally tear than cut. So hopefully episiotomy plays no part in your birth experience. If it does, you'll be fine. They'll numb the area, they'll stitch you up, you'll be good. Okay, ECV, also called external cephalic version. So this is a process used to turn a breech baby, so baby that's not head down, that's butt or foot first. We want the baby to be head down. So an ECV typically involves you being given a medication via IV that helps to relax your uterus, and then the care provider strategically presses on various areas of the abdomen to try and turn the baby. So an ultrasound is sometimes used during this to help to kind of guide the care provider, know where to press. The baby's heart rate is constantly monitored during an ECV. And I often get the question, will it hurt? Probably. But a benefit of it hurting is that it gives you a chance to utilize those pain relieving techniques. So the deep breathing, the relaxing can really help during an ECV. It's not guaranteed to work, and sometimes even if it does work, the baby turns back. But I have had clients that had really successful results with an ECV. Okay, fontanelles, also known as the soft spots on baby's head. The fontanelles are the 2 spaces between the baby's 5 skull bones where the sutures, the soft membrane gaps, intersect. So, and strong membranes that protect the brain cover them. So the fontanelles, they're located near the front of the skull on the crown, and on the crown back here. So while many new parents are terrified that they're going to poke a hole through the baby's head, you're not. Those soft spots are a lot tougher than they look, and they should usually close up by baby's 20-month birthday. Okay, 4th trimester. So this is a term used to describe the 3 months after baby's birth. It was nicknamed the 4th trimester because the baby is still completely dependent on you during this time. You're both going through a really profound time of change. It can feel very vulnerable. So yeah, it can be nice to kind of hole up at home during the 4th trimester, fully focus on nurturing yourself, your baby, get to know each other, rest as much as possible. Gestational diabetes. So this is diabetes, aka high blood pressure or high blood sugar, excuse me, that develops in a pregnant woman who did not have diabetes before conception. It's often just managed by a healthy eating plan and exercise that your care provider will help you with. In some cases, insulin injections are needed. Glucose tolerance test. So this is a test that requires drinking a disgusting sugary drink between weeks 24 and 28 of gestation to check for the gestational diabetes we just talked about. It consists of going to a lab after fasting for at least 8 hours, which is already super unfun on its own. And then you have your blood drawn, and then you drink that sugary drink I was talking about. It's kind of like a combination of cough syrup and really sugary Gatorade. And an hour later, you'll be given another blood test, which evaluates how your blood reacted to that blast of sugar. Because some women feel like total crap after drinking that drink, you can ask your care provider about other more natural foods or drinks that you can use before the test. For example, I've had some moms that were allowed to just drink like apple juice or eat a banana before. So ask your care provider if that's an option. All right, group B stress or GBS. This is actually a bacterial infection found in the vagina or rectum of about 25% of women. And between weeks 35 and 37 of gestation, a swab test will be used to determine if you have GBS. While this typically does not cause any symptoms in the mom, it can be dangerous if it's passed on to baby during delivery. And so to prevent this, moms with GBS are given IV antibiotics at the onset of labor and every 4 hours after until baby is born. Okay, finally, high-risk pregnancy. So many care providers consider pregnancy high risk if a woman has pre-existing conditions like high blood pressure or diabetes, she's obese, carrying more than one baby, or is over the age of 35. That last one creates a lot of controversy because, of course, you could have a woman at the age of 35 who has always eaten incredibly healthy, is exercising, has great genes, she's super healthy, and say a 25-year-old that is incredibly unhealthy. In my opinion, the 25-year-old would have a higher risk pregnancy than the 35-year-old. But again, simply because of age, women 35 and older are considered high risk. So again, controversial. If you're healthy and you are considered high risk simply because of your age, I really recommend talking to your care provider about that and encouraging them to not treat you like you're high risk and to treat you like you are a healthy, fit, pregnant woman, because that is the truth of who you are. Okay, that is part 2 of the birth terms defined. Part 3 will be coming up next.